William Rees is full of life, but life hasn't been easy.
It does tickle.
He's 4 and waited more than a year to be diagnosed with autism. Before that diagnosis, he couldn't receive any government support.
I can't even explain to you how stressful it was. It's hard to put into words.
Hospital records obtained by the ABC show William's story is common. In his southwestern Sydney region of Campbelltown, children wait an average of 12 months for an appointment at the public hospital so they can get a diagnosis. Some have waited almost double that.
I started every assessment with an apology about the delay.
Paediatrician McDonald used to work at Campbelltown Hospital but left 3 years ago.
Mostly it was about frustration about this. I just felt disappointed for the families that we were trying to help.
When the ABC first reported on this issue 3 years ago, the New South Wales Health Minister said if more needed to be done, it would be. But the FOI documents show there have been no increases to staffing levels since 2010. That's 10 years of no change, despite a booming population putting additional strain on resources.
The health system's stretched. There's a limited purse to provide all the increase in funding across health service delivery. But I think this is also really important. It's a false economy to set children off on a back step.
Less than 60 kilometres away from Campbelltown in the city's east is the Sydney Children's Hospital at Randwick. Children seen here wait a minimum of 2 months and a maximum of 10 for an assessment. That's partly because parents who live here are more likely to be able to afford a private appointment for their children, taking pressure off the public system.
It is a form of developmental apartheid. We're losing sight, I think, of what our system should be providing for all people, not just for the wealthy.
The issue isn't confined to Sydney. In Melbourne's southeast, Monash Children's Hospital also has an average 12-month wait for an assessment, compared to half that at the city's main children's hospital. But what's more surprising, Monash rejects half of all referrals for developmental delays because it doesn't have enough resources. And with early intervention key, paediatricians are speaking out.
At times you have to make the diagnosis on what little information you've got. It is not good practice, but it's sometimes all you can do.
Andrew McDonald is Jenny's husband. The former State Labor MP says because of the long wait times for diagnostic assessments, doctors are now bypassing best practice, giving children with developmental delays a diagnosis on the spot instead of referring them to child assessment teams.
At times you feel hamstrung. You need to act immediately. You would be so much better if you could access a proper multidisciplinary assessment to get appropriate care.
The federal government maintains children with disabilities don't need a diagnosis to access support through the National Disability Insurance Scheme. However, many parents and doctors say that's not always the case.
I think practitioners' experience is that the NDIS does put a lot of emphasis on a diagnosis before support will be delivered.
The NDIS minister says the federal government is trialling a different approach to speed up the assessment process, observing kids in their own environment, a playground instead of a hospital, and for some, the approach has merit.
We want to see how they're using those skills when they're at play, when they're negotiating with their peers, when they're waiting their turn.
But for doctors, the answer is clear: more money for assessment teams.
What we need to do is to ensure that these forgotten children get appropriate access to care in an appropriate time.
The Victorian government says the rollout of the NDIS has increased pressure on diagnostic teams and the Commonwealth needs to hand over that money.
We don't have any plans to step in and solve the failings of state hospitals. No, we do not.
For Shanice Rees, it doesn't matter who fixes the system as long as there's change. Her youngest daughter Gracie is now also on the wait list for an assessment.
I feel like I've got another fight on my hands.
Another fight for fairness.